Dr. Alex Earl, and we're at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is a time I get to spend with you guys and answer all your plastic surgery questions. And today's topic I thought would be kind of cool because we have spent all this time talking about plastic surgery and what it can do for you and the services that we can offer, etc., etc., etc. But what can plastic surgery not do? Okay? So a little bit, we're kind of flipping it around here, a little bit of an interesting topic because, of course, plastic surgery is not a solution for everything, right? So there are a few things that plastic surgery essentially just can't fix. And of course, everybody needs to be aware of that. And so we're going to talk a little bit about that here today. All right. So what can plastic surgery not do? All right. That's the subject for today. And if you guys, these are the ones that I kind of thought of, but you know, there's other ones out there. You know, go ahead and write to us as well, and let us know what are some other things you believe plastic surgery can't do. Okay. And I just want to say hi to everybody here. We're on YouTube, on Instagram, and on TikTok. What's up, my TikTok players? Go ahead and make sure you send us a whole bunch of those thumbs up. I love those dinosaurs as well. So send me a couple of those. All right. So we're gonna go into something, you know, a little bit more about the frame, and then of course we also talk about basically mental health issues as well. All right. So plastic surgery, as you know, it's the surgery essentially of the skin and soft tissues. So what it is not surgery of the muscles, right? So plastic surgery cannot really change your underlying muscular frame, okay? So it can't change your underlying muscular frame. So what does that mean? Say, for example, a very common area where we talk about this is the waist, okay? So when we do liposuction, we're removing fat that's between the skin and the muscle, right? So that is a fat that we can shrink down. But once we get to that muscle layer, okay, we can't shrink that down anymore. So there are certain patients where that kind of underlying muscular frame is very straight, right? They have a little bit of a straight kind of up and down here, and they don't have a lot of the waist really coming in. And so even if we do liposuction, yes, we can make it better, right? We can give you a little bit more of that curve there. And if we can combine that with some fat transfer, we can bring in the waist a little bit, pop out the hips a little bit to give you more of a curvy body. All right, but there's a limitation there. There's only so much that we can do because once we get down to that muscular frame, we can't shrink the muscle down, right? That's your muscular frame and it cannot be changed. The other thing related to muscle that we can change with certain procedures, and perhaps with others, is the how strong or how weak the rectus or these front abdominal muscles are, or whether they're separated or not, right? So a lot of people come in and they want to avoid that tummy tuck. You know, they're like, Doc, I really want to avoid the tummy tuck. I don't like the scar. But they come in with a weak abdominal wall, and so when they're on their side, it looks kind of, like they're still pregnant, and that's because either the wall is weak or because the muscles are separated. So if we do liposuction alone, it's not going to fix that. Liposuction does not address those muscles. The only way to fix that is with a muscle repair that we do with typically with your tummy tuck. Okay? So these are things you got to keep in mind. So plastic surgery cannot really change your muscular frame, okay? Now, if we're doing a tummy tuck though, yes, we can strengthen the abdominal wall and we can bring those abdominal muscles closer together if they're separated by something that's called a diastasis or muscle separation, okay? All right, your skeletal frame, okay? So plastic surgery cannot change your bones, right? Again, this is surgery of the skin and the soft tissues. We're not changing your skeletal frame at all. So if you have just naturally a wider pelvis, you're going to naturally have wider hips. If you have naturally a narrow pelvis, you're not going to have as much hips. If the distance between your last rib and your pelvis is short, we're not going to be able to bring that waist into too much. If the distance between the lowest rib and your pelvis is a bit longer, then we have more room to treat the soft tissues in between and bring in the waist more, okay? Another thing that has to do with your skeletal frame is your hip dips, okay? Sometimes, if the pelvis is relatively narrow, and you have a big, what we call a trochanteric depression, which is that depression between where the upper pelvic bone is to like the lower, where the femur or the leg bone starts. If you have a very deep depression there, we can only kind of push that out so much, okay? We can't fix a skeletal frame in terms of asymmetries. A lot of patients have what we call scoliosis, meaning that their back is not completely straight. Their back has some curve to it, all right? Also, a lot of patients don't have a completely kind of symmetrical pelvis. The pelvis may have what we call a tilt, pelvic tilt. So one side is higher than the other. This leads to asymmetries in how curvy one side of the body is compared to the other. Typically, the side where the pelvis is a little bit higher is actually a little bit more curvy, and the side where the pelvis is a little bit lower is more straight, okay? So we cannot fix underlying asymmetries in your skeletal structure. So if you're different, and it's fine, it's perfectly normal to be a little bit different from side to side, but the expectation can be that you're going to be perfectly symmetrical afterwards, especially if you have some asymmetries in your bony structure, which we can't change. Okay? So we're not going to be able to change your skeletal frame. Alright? Alright, now we'll move on to some of the more kind of mental health issues or psychiatric issues. Okay? So one thing that plastic surgery cannot change is what we call BDD, or body dysmorphic disorder. What is body dysmorphic disorder? This is when a patient looks at their body, looks at themselves in the mirror, and what are, you know, to anybody else, very, very slight, very small differences, they perceive it as huge differences, like huge asymmetries or huge deformities, okay? That's what's body dysmorphic disorder. And so these patients tend to seek plastic surgery to change these things which they think are so wrong with them. The issue is that because it's more of a mental health issue and not really a physical issue, even if you go and you try to fix it, while a lot of these patients may be happy with it in the short term, they're not going to be happy in the long term because you haven't fixed the underlying psychiatric issue, which is that body dysmorphic disorder. So we actually, most plastic surgeons, including myself, if we know that a patient has this diagnosis, I typically will not do surgery on the patient. Why? Because that patient is just never going to be happy. Okay, it doesn't matter how great the result is, they're always going to find something that they're unhappy about, and so it's just not worth it getting into all the potential, you know, issues, complications, time, effort, money, and everything that goes along with plastic surgery. For that patient to then just not be happy, because you know they're not going to be happy in the long term until they deal with their body dysmorphic disorder. So the right kind of physician to treat BDD is not a plastic surgeon, it's actually a psychiatrist or a psychologist. That's the type of provider that you need to treat this, not plastic surgery. Plastic surgery is not going to fix it. Okay? Similarly, for any major, what we call major psychiatric disorders, okay? I'm not talking about just being a little sad from time to time or thinking that your day sucked or things like that, all right? I'm talking about like major depression, okay? Depression that requires psychiatry or psychologists and potentially medications, okay? Again, even if, you know, someone's unhappy with their body, but they have major depression, even if we fix, you know, supposedly fix the issues, it doesn't fix the major depression. That patient's going to continue to be depressed. They're going to continue to be unhappy with their results and with everything else, because the issue is a psychiatric disorder, not a physical issue. Okay? So we can't fix major psychiatric disorders. Common ones we can't fix, for example, bipolar disorder. We can't fix major depression. We can't fix some of the important personality disorders that are out there as well, such as, you know, histrionic personality disorder and things of that nature. Okay, so typically if I have a patient that is asking for plastic surgery and they have a major psych disorder, I will get a clearance letter from their psychiatrist or psychologist before we move on, because we want to make sure that they're in the best mental state they can be before undergoing a major surgery such as this. Okay. Now, these, I would say, you know, muscular frame, skeletal frame, that's pretty common. Body dysmorphic disorder, major psych disorders, not so common because we kind of screen these patients beforehand. A lot of plastic surgeons won't take body dysmorphic disorder. This, we have to make sure that the patient is doing well and is in stable condition, so not too common. This one, believe it or not, is actually pretty common. Patients try to do plastic surgery not for themselves, but because theoretically somebody else wants it, all right? And they feel like if they change their body, if they do a change like this, that it's gonna fix their relationship, right? The classic one that we get is like, you know, my husband doesn't want to touch me anymore. He thinks that, you know, after I had the kids, that my body is not, you know, what it used to be. And so I'm doing plastic surgery for him because I want to fix my, you know, my marriage. Okay, that's the classic one there. This is not going to fix it. Okay, plastic surgery is not going to fix it, even if you look outstanding, you have the best result, because that's not really the issue, right? The issue is not that. There's a problem in the relationship, okay, and the issue is not a physical issue, it's a relationship issue. And so plastic surgery will not basically fix a broken marriage, or, you know, won't get you back to your old boyfriend or your old girlfriend. Okay, doing plastic surgery for somebody else is not the way to go. Okay, I definitely do not recommend that. You do plastic surgery for yourself, okay? Because what plastic surgery can do is boost self-esteem and boost self-confidence and make you feel better about yourself, okay? And that then you can portray in, you know, perhaps a future relationship or something of that nature, okay? But it's not going to fix a broken relationship. And please do not do plastic surgery for somebody else, okay? This is something that you do for yourself so that you feel better and that you feel empowered, that you're taking control of your life, okay? All right. And then the last one, I've seen it go either way. So I put question mark here. Can plastic surgery get you a job? All right. Look, can it sometimes make it, you know, depending on what job it is, you know? Yeah, potentially, you know, if you're working at a bar, if you're having OnlyFans, you know, perhaps things like that. Can it help improve the chances? You know, potentially, yes. But it's not the reason to get plastic surgery, okay? You know, I don't want someone to be upset at me because, you know, we did a procedure, they look great, and they're like, oh, but it didn't get me X, Y, or Z job, okay? That's really obviously not the point of what we're doing here, all right? So there's definitely no guarantee that plastic surgery is going to get you that job, whatever it is that you're looking for, okay? Whether it's a, you know, dancing at the bar, OnlyFans, etc., okay? Once again, kind of related to what I talked about just here, it's about you feeling great about yourself, okay? That's really what it's about. Now, if you have, you know, surgery done and you feel empowered and you feel a boost in self-confidence and your life changes in that way, and that self-confidence then exudes, then yes, potentially can get you, you know, it can help you in terms of a job or something like that, because, you know, anyone who's has a whole rush of self-confidence, if you're getting interviewed, etc., you know, that can be kind of felt, and it will help in that sense, okay? But once again, do plastic surgery for you, all right? Okay, and that's what I could come up with. I'm not sure if anybody came up with some other ones out there, but I'm happy to discuss and answer any questions you guys may have.
Could you ask for more likes on both accounts, please?
Oh yeah, of course, come on. I think it's a very, very important topic, because, you know, we need to know kind of what the goals are whenever we get into a kind of, you know, a long and not easy journey such as this, okay? So yeah, just boost up some likes for this topic right here.
Doug, are you on Real Self Review?
Yeah, definitely on Real Self, so you can look me up. I believe I'm under S.Alexander Earl, MD, so definitely go to Real Self and check it out.
Okay, let's start with the questions. Do you recommend a BBL with a skin tightening after a mommy makeover if I want a snatched waist?
Yeah, so and that's typically the way that I would recommend it. So you want to have your mommy makeover with your tummy tuck first. 3 to 4 months later, then you can come back for your liposuction and BBL, okay? And that's going to help, bring in the waist a bit more, remove some more of the fat in that central belly area, of course the back and the flanks, and then we can transfer it to, to the hips and the buttock to create more of that hourglass shape. and really kind of bring in that waist as much as we can.
Tummy tuck. What are the necessities to bring to the surgery?
To bring to the surgery. Okay.
Yeah, the day of the surgery.
Yeah, so well, we always meet our patients the day before surgery, right? That's when we do your pre-op. We talk about the procedure and what time to come in and everything that you need to bring for surgery day. But also a lot of things we kind of provide for you here, right? So we're going to give you all your prescriptions. We're going to give you your abdominal binder. We're going to give it to you on the day of surgery. Your compression stockings we give on your day of surgery as well. And the other thing that we do here at Pure is that we give you what we call a sequential compression device. A device that goes on the legs there and keeps the circulation moving to minimize any risk of blood clots. So all of that is actually provided by us for you, so you don't necessarily need to bring that, okay? Now what you do need to bring is kind of things to protect the, if you're staying in your home, the hotel, the Airbnb, you want to have some like pads and chucks and things to protect the areas you're going to be in the hotel. You're probably going to want to bring some extra gauze as well. Basically we give you a list of all the things that you need to bring during your pre-op call, which is typically somewhere between around 45 days before surgery. So just make sure you read that entire list so you have everything, you kind of check everything off so you're ready for when you get here.
Are you Alex Earl's dad? It's for real.
Yeah, I'm the brother, older brother. No, I wish I could say we had some sort of relation, but as far as I know, we don't, although those names are very, very similar.
Okay. Do you treat diastasis recti?
Definitely. So that's one thing when we're talking about the kind of muscular frame that we can fix with plastic surgery. So what is diastasis recti? That means that the two rectus muscles, which are right here, those have been separated. That's typically due to either pregnancy or massive weight gain followed by massive weight loss, okay? And so when we do a tummy tuck, we then do that muscle repair or muscle plication, where we then bring the muscles back together again and we strengthen that abdominal wall.
I like this question. Look, can you get an infection from the water by taking a shower too soon after surgery?
Potentially, you can, all right? So for most surgeries, you want to wait at least 48 hours before your first shower, okay? So that you don't get kind of all the areas wet too soon. But after 48 hours, it should be okay to kind of shower normally. Soap and water can hit all the areas. You definitely want to be using either a Hibiclens, which is a special soap, or a Dial like antibacterial soap, also to minimize any risk of infection.
Doc, what's the recovery rate for over 45 female patient?
The recovery rates, if you're 45, you're essentially a good candidate for surgery, right? You're going to recover similarly to most patients, as long as, of course, you're healthy and we check, all your medical background and everything is okay. I would say for most surgeries, it takes about 6 weeks. So that's including like my makeovers, tummy tucks, lipo 360, and BBL. So during those first 6 weeks, there's no heavy lifting, no strenuous activity. You want to take it easy. All you want to do is walk. But walking is very, very important, okay? We really don't have any cutoffs at the age of 45 unless you have major medical issues. Now for lipo 360 BBL, I do have a cutoff at 50 because I found that it's a surgery that involves major, what we call fluid shifts. And sometimes, patients, even though they, appear to be healthy in terms of their labs and everything else, they don't tolerate those fluid shifts very, very well after surgery.
Okay, what's a good BMI for 5'1" female? I'm 5'1" and 180 pounds.
Okay, so you want your BMI to be 30 or less, okay? So when you kind of look up that BMI calculator, which you can look up on Google or anywhere else, it's going to ask you for your height, and you put in 5'1", and then kind of play around with the numbers to see what will get you to a BMI of 30 or less, and that's where you want to be, okay? If it's above 30, you want to potentially, do a little bit of diet, a little bit of exercise to kind of bring it down to 30 or less, because that's the most ideal in terms of your long-term results.
This is a good one. How to deal with anxiety and nervousness day of surgery?
Yeah, all right. So if you're someone who suffers from anxiety and you take medications such as Xanax, it's a benzodiazepine, then it's okay to take that before surgery as well. Okay, it's one of those. It is one of the medications that you can take up to the day of surgery. So if you have that issue and you need the the anxiolytic, that medication to kind of decrease the anxiety, you can go ahead and take that. Okay, but I think what really helps is of course coming to a center where everybody treats you well, where people communicate well with you, where we provide a lot of education. Because I think one of the things that creates a lot of anxiety is just the not knowing, right? Like not knowing what to expect, not knowing what happens afterwards, and things like that. So that's why we spend a lot of time in terms of educating our patients and communicating with our patients. Because once you kind of know what to expect, that's going to bring all those anxiety levels down. And then of course, you know, how we treat the patient, right? You want to have excellent customer care. You want everyone on the staff to be kind of calm, cool, and collected. And that's going to help a lot as well.
Okay, how much fat do you need to do a skinny BBL?
So it really depends on the patient's like kind of goals and desires, okay? But I'll tell you like the lowest, you know, for BBL typically the lowest BMI that we'll take is about a BMI of 21. And for a BMI of 21 for most patients, not all, but for most patients, we can typically get about 2,000 cc's of fat out, which is plenty to do a skinny BBL.
Okay. Can a round 2 help with minimal loose skin on abdomen, about an inch?
So if you have some loose skin, doing just lipo alone is probably not going to take care of the issue, okay? We need to add something that's going to help with the tightening of that skin, all right? So if you have kind of minimal loose skin, then typically what I would add to that would be something like Body Tight, which is what we have here. You probably have heard us talk about it before. We're actually the #1 Body Tight clinic in all of Florida, okay? We have, we have the most volume, we have the most experience with this procedure. Our patients love it and it turns to work really well for mild to moderate skin laxity, okay? Now, if you have more like moderate and up, then you may need to consider a surgery where we're actually removing excess skin. So if it's moderate, perhaps a mini tummy tuck. If it's more severe, a full tummy tuck. These are the considerations that need to be taken. So that's why it's so important for me to be able to examine you and then give you the best recommendation in terms of what should be the next step.
Okay, we have some new followers on TikTok, and
All right.
okay, she asked, "Is it safe to get nose fillers if I have nasal polyps?"
Yes, so the nasal polyps in itself shouldn't be an issue because the nasal polyps tend to be kind of deeper. They're within the nasal canal, right? And so when you're getting fillers from the nose to do kind of what sometimes they call like liquid rhinoplasty and things like that, you're in a much more superficial plane. You're basically between the skin and the cartilages, which are the ones that the cartilages are they're not bone, right? They're made of cartilage, but it's what gives the structure to like the lower half of the nose, okay? So if you have nasal polyps, using the fillers there should not be an issue.
How can you bring swollen down on a tummy tuck?
Well, so the keys are compression, massage, and time, okay? So compression, you know, while the drains are in place, you're gonna be wearing your abdominal binder. Once those drains are out, you can switch to your faja, okay? Massage is definitely gonna help, you know, initially with massage to the flanks and the waist, the areas that we did the liposuction, and a little bit to the lower back to relieve some of the muscle tension. And then after 2 weeks, you can do massage to the kind of front part of the tummy tuck, okay? And then because it's the most frustrating, and I know, but it just takes time. Tummy tucks can easily take 6 months, 8 months, 9 months, even up to a year, a full 12 months for a lot of that swelling, especially in that suprapubic area, to go away.
I have a colostomy bag.
Mm-hmm.
Can I get lipo or tummy tuck?
So no, I would at least not in a kind of outpatient elective setting like this, okay? Because when you have an ostomy, basically you are between part of your bowels, okay, and the skin, which means that bowel is going through the muscle, through the subcutaneous fat, out into the skin, right? And if you were to injure that, in any way with liposuction, with the cannula, or during a tummy tuck, that would create a major issue, okay? Because you would have an injured bowel. That means that things can seep out of the bowel into the tissues. It's going to create infection and major problems, okay? So unfortunately, if you still have your ostomy, you wouldn't be a candidate. Now, if you're lucky and like down the line you're able to do an ostomy reversal, okay, then you could potentially consider some of these operations.
How long should a BBL patient wait to have sex?
So you're gonna want to wait 6 weeks. That's right. So there's no strenuous activity, no heavy lifting for 6 weeks, and no sex for the first 6 weeks.
Okay. During lipo and BBL, do you insert all 4 liters of fat, or is there a fat transfer limit?
Yeah. So it's very rare that we put in all 4 liters, not because there's necessarily a limit. Actually, the main, well, first of all, we don't want to create diaper booties, right? We don't want to create ant booties and diaper booties. Okay, that just doesn't look good. It looks very fake, and it looks very surgical, and it's typically not a long-lasting shape. Like a lot of times we have patients that put in too much volume that are now coming back for their BBL reversals. Okay. All right, that's number one. Number two, what usually becomes a rate limiting step is how far that skin can stretch. Remember, we're putting the fat now in the safe space. The safe space is between the skin and the muscle in that subcutaneous plane. And that skin can only stretch so far. But eventually it's going to get to a point where it gets really tight. It can't physically expand anymore, and therefore you can't place any more fat into that area.
Okay, what can cause a rescheduled surgery appointment date?
To reschedule?
Yeah.
It could be, for several reasons, anywhere from like financial reasons to all the way to your labs, weren't within normal limits, or you didn't get the clearances that you need, or things of that nature. So there can be potentially, quite a few reasons why we might need to reschedule. So that's why it's so important to kind of really, take the time to listen into that pre-op call. You're going to get that approximately 45 to 60 days before surgery. They're going to go through a lot of information. They're going to give you all the timeline, like when do you have to have your labs in by, when do you have to have your EKG, your clearances, when do you have to have your final payments, when you have to have your COVID test, etc. So it's really important to listen into that call, jot down all the dates. Of course, we send you all the information written down as well, and kind of just stay on top of it so that there aren't any last minute issues or last minute reschedulings or cancellations. Oh, and remember, no smoking for 30 days, no estrogens or oral contraceptives for 30 days, and please don't get pregnant, okay? How many times we come in and we do the pregnancy test and it's positive. Or you come in and we do the drug test and it's positive, okay? Or you come in and we check your height and weight and you're over the BMI limit. All right, these are all your responsibility. You got to be under the BMI limit. Of course, you can't have any drugs on board except for THC, which is fine. You can't be pregnant, okay? All right.
The last question for today. Are you still doing post-op appointment the day following surgery on the phone?
Yes, so post-op day 1 is typically a virtual appointment unless you're getting your massages here with us, in which case we'll see you here, of course. But for the most part, it's a virtual appointment. And then your post-op day 5 appointment is going to be all live here at the clinic. And then we do have a 6-week and a 3-month follow-up, which is really up to you. It can be virtual or in person. Most patients want to do it virtually, which I think makes sense, especially if everything's going okay and there are no issues.
Before leaving, I want to read this special message for you, Dr. Earl. Dr. ATL Doll says, much respect to Dr. Earl because he changed my life.
All right, awesome. I'm so glad to hear it. It's always a pleasure. It's a pleasure to have you. It's a pleasure to have all our patients here at Pure, and also like everyone listening to these lives. It's been like what 3-4 years now. A great experience. Where Instagram has always been great, but now TikTok really getting into these lives. So we're really happy with all that. I hope you find these subjects interesting and educational. Like I said, I'm always happy to discuss anything that you guys might want me to talk about. So make sure you can send us ideas for direct messaging, and we'll make sure to talk about that as well. All right, everybody. Okay, we'll catch you all next week on Hump Day with Dr. Alex Earl. Ciao.